Alrighty, you guys, I am so excited. I have my good friend and my Instagram big sis, Dr. Stephanie Tran. She is a fabulous endodontist in New York City, and she's also just someone I've been so excited to have on the podcast since day one. Dr. Stephanie, welcome to the podcast. Start with a rapid fire series of questions. I thought this would be like a fun little way to introduce you.
All right. I'm excited. Hi, everyone. Thanks for joining in.
Okay, so this sequence is going to be like a 1, 2, 3 format.
Okay.
So first, number one. What's your number one, only one product in your skincare routine?
All right. Definitely sunscreen. As you know, anti-aging, but I really like the Asian kind of sunscreens that are like super hydrating. So my number one is currently like that viral one, Beauty of Joseon, that Korean sunscreen. It's like super moisturizing and hydrating.
Oh my god, you are such a big sister. Saying like the sunscreen, I was like, I swear to god, she's gonna say SPF, because like my sister's a derm and she's just like SPF everything.
Yes.
I'm like, are you sure it's not this really cute like serum with the cute packaging and the applicator? She's like, no, SPF.
But a lot of the Korean and like Asian SPFs are like serum or skincare based. So definitely good to look into those.
Where do you get cool like Korean products like that? Is there an online place or in person?
I mean, you could try Amazon if it's like a certified Amazon like store. So like certain ones like Innisfree and stuff like that are actually,
Oh yes.
they have their own Amazon like store. But like if you're worried about if it's certified or not, there's a lot of like Korean, female founded Korean skincare websites. There's a bunch of them out there that you can do. I mean, I live in New York City, so I'm really lucky. There is K-Town, and so a lot of the stores have Korean beauty products now. And then if you really want to be safe and have a great return policy, obviously Sephora has a lot as well.
Question number 2 now. Your favorite 2 restaurants in New York City.
All right, I'll give you a high-end one and a low-end one. Okay, so a lot of my followers and friends know I'm a big foodie. I love food, and so I will actually like live that dinkwad lifestyle focusing on food. And if for anyone who doesn't know, dinkwad is like that TikToky acronym for double income, no kids with a dog. Love that lifestyle. So because I really like food, so my first number one, it's a little more high end, but like worth the price, is one of the best omakase in New York City, which also means that's one of the best omakase in the US period, is Sushi Noz. It's amazing omakase, like really good sushi that's also interesting and slightly innovative without being like too modernist or anything. And then the second one that is like affordable price range, a little bit of a splurge, but great for like a special night out, is Atto Boy. So in New York City and in the US in general, there's definitely a big surge of cool Asian American chefs who are like trying to bring Asian flavors through into their cooking. And Atto Boy is done by this like Korean couple, and it's really interesting, innovative food. So definitely highly recommend. Amazing fried chicken, and like all the dishes are really innovative and good and great.
I love that nowadays, because I feel like in the past there's this connotation or expectation that Asian food had to be cheap. Like it's like, how come French and Italian food can be this like upscale kind of experience? And then now I feel like there's so many cool like Asian fusion places and like modern places popping up. Jimmy and I are actually going to New York City for like super quick, like 2 days, next week actually. So I'll have to run some more recommendations by you.
Oh, for sure, for sure. Like, but Atto Boy, if you can get a reservation, is worth it.
And then last rapid fire question, although I always turn it into like non-rapid fire because I just keep asking the guest more. It's more of like a moderate paced question round. What are 3 words that you would use to describe your sense of style?
Okay, so I really like fashion, so I love this question. I think the 3 words that would describe me are like sophisticated, like masculine, feminine as like a hyphenation, because I really like that mix, and then a little bit of edge.
Oh, I could so see that. I feel like that is so spot on. How did you, like growing up, when you were developing your sense of style, were you always like, this is it? Or did you try on a bunch of different hats and then eventually settle on like these 3?
Oh, definitely tried a bunch of things. Like, I mean, I'm a millennial, that gives away my age. So I definitely tried a lot of like the slightly punkier stuff, slightly like, K-poppy, Asian influence stuff, because there was a lot of like Japanese and Taiwanese and like K-pop stuff influenced during that generation. I mean, I think you and I are not too far in age, but
Mm-mm, yeah.
and then also, trying things that are a little girly or a little more masculine, and also it comes with like age and figuring yourself out, which I think is definitely something that's like a big theme. I think hopefully what we'll talk about is just like trying to figure yourself out and just trying different things.
Part of why I want to have you on is I feel like, every big sister, like we all, as little sisters, we look up to you guys where like they have it all figured out. But I recognize now, like even the big sisters go through phases where like they're still figuring things out. So when you graduated from your dental school, you graduated from University of Pacific at age 23. Like
Yes.
what were the thoughts and feelings in your head being a graduated licensed dentist at 23?
It was like, oh my God, I'm a doctor now? That's like, I feel like I barely can drink. um,
Exactly.
Actually, and I wasn't even like the youngest in my class by far. I was like
Really?
fourth, I think. There was a bunch
Okay.
of us who were really accelerated. But also I will definitely say it was like, oh my gosh, thank goodness I have gotten here, because I wanted to become a dentist since I was like six or seven. So that was definitely, I was like very laser focused on that particular goal. And so it was something I was working towards for a long time. And that's just because I really loved it right from when I was young. Um, so that was a big thought. And then also was like, oh my gosh, what is the next step going to be? I spent my whole life so laser focused. Now I have it. What's going to be next? Which is very daunting, but also really exciting at the same time.
Oh my gosh, wait, you perfectly articulated like kind of how I feel right now because like graduation is now like 60 days away. So everyone's like, "Oh, it's so exciting." But like
Mm-hmm.
I don't know if it's just because I'm someone that really doesn't like change, but a part
Mm-hmm.
of me, like all I know is like school. For
Mm-hmm.
like 2 years of undergrad, 4 years of pharmacy school, 4 years of dental school. And
Mm-hmm.
I'm kind of like scared isn't the right word because like I want to get out of here. But I do kind of feel some sort of like dauntingness of being like, what do you mean there's no more like validation from teachers and there's no more like academic achievement?
Mm-hmm.
Like, how did you handle that daunting thought?
It was more like, oh my God, thank God I don't have any more tests and practicals and checks, but also, wow, I don't have that hand holding or that guidance anymore,
Right.
which is exhilarating, but definitely a little daunting. So, I think we're getting ready to graduate. You have to first take like that deep breath and be happy with, oh my gosh, you've achieved so much. You've worked so hard to get there, and you didn't just get there from nothing. You worked so hard. So, that same kind of mentality and hard work mentality is still going to continue. It's not like it's just going to disappear into nothing just because you graduated. So, be confident with that. And then the other thing is like, remember that you have actually learned everything to get there and be like a great, safe beginner, but not just have about all the skills to like be that safe beginner, but all the skills to like critically analyze what the next step would be, or critically analyze what the correct maybe decision should be, or the correct like treatments might be, even when things change or even when things develop. Because what we learn in school isn't just like the end all be all, but also like it's that critical thinking of analyzing situations and learning new things, and then applying those new things to what really works and what doesn't.
It sounds like a lot of that is then like developing your own sense of judgment because it's kind of like in school we always like almost have that safety net of
Mm-hmm.
like knowing that like someone else's word goes, and
Mm-hmm.
then now it's kind of like okay, like no, you need to learn how to like you said, critically think and like apply everything that you were taught
Mm-hmm.
into now real life practice. Well, in that case, like what was something that you feel like when you first got out of school, it used to like scare the living crap out of you, and now you're like, that was so silly for me to worry about. And
Mm-hmm.
then alternatively, what's then something that you're like, I didn't see that coming, like that was a
Oh yeah.
surprise.
Oh, I love that one. Okay, so one of the biggest things I always say is that when people, okay, so in relation to this, I want to like give everyone the advice. Don't feel like dental school was it for everything that you need to know, or what all the decisions you make in the future are going to be. So, one of the questions I often get was, did I know I wanted to go into endo? Not at all. I knew I really liked endo, but I didn't know I wanted to specialize in it. I actually originally wanted to be like restorative. I really loved like cosmetic and aesthetics and full mouth and like bringing smiles to people's faces, the like, before and afters, etc. And I love that, and that really has built a background to my endodontic treatment as well as my comprehensive like full comprehensive care diagnosis when I approach endo. But be open to what you will learn and what you realize you really do like or what you really don't like. So that was one. And then one of the things that I thought in dental school I hated, I would never like to do, that was oral surgery or just surgeries in general. So it just happened to be at my dental school. In my experience, I didn't have that many surgeries. I had a ton of endo, which is why I liked endo. I was terrified of surgery. Coming out of school, I thought, no way, I'm not going to be really good at it, or it just seemed really daunting. And then I did a GPR that really helped because I was seeing all different types of surgery. I did perio, I did oral surgery, I did complicated like medical management type stuff and that, as well as I had a lot of advice from mentors, and I practiced as a general dentist for a few years. I did a lot of surgery in that type of practice, and I realized I really liked it and wasn't as scary and daunting. I just needed the experience and some of the guidance from like GPR, and as well as some of the more information and learning how to do it better and easier, that made me actually really love it. And so even now, I still really like surgery. I still like to do other like surgical procedures, even in endo. So like apicos or extract. Every once in a while, I'll do an extraction, or like some of the more odd stuff like external resorption repairs and things like that. Any kind of surgical procedures, excision and INDs, incision and drainage kind of procedures. They don't scare me as much as they used to. And then another thing that I thought I really liked in school, I'm like, you know what? It's actually a lot harder than it looks, and it's just, not quite as gratifying as actually some of like the composite restorative. I'm like, in school we do so many of them. I'm like making things so beautiful, and now I'm like an endodontist, and I'm like, oh my gosh, it's a class 2 with a subgingival margin and bleeding everywhere. No, forget it. Like, I don't really want to deal with all the restorative all the time. Like, I'll do restorative too. And I'm a restorative dentist by background, but like, that doesn't mean I love all of it anymore. Or even like crowns and stuff like that. I'm like, oh my gosh, it just, so much has developed, and that's just not really my jam anymore. But it really shouldn't be. If I was still liking to do crowns as an endodontist, I was like, that's too much.
That's true. It's so funny to kind of hear about your evolution of what you thought you liked and then you realize you didn't. Because I think a lot of times, like earlier on, at least in our careers, we have this idea like, this is who I'm going to be. And then when things start to stray, it's like, no, but it was supposed to be like this, not like this. How did you like find that courage then to really follow like what you truly wanted rather than on paper what you always said and thought you wanted?
These are such great questions. By the way, I have to really commend you. You really do a good job of asking questions.
Oh, thank you.
Yeah, so that is a great question that I really like to talk about when other, younger new grads ask me about like my journey or like how I decided on things. The biggest thing is to just keep an open mind to all aspects of dentistry. So keeping an open mind to how you might want to practice. When we're in school, we're taught, oh, you only want to do X, Y, and Z for your path. You're either going to own your own practice, associate, and then buy somebody out. Like, it has to be certain things. If you don't buy in right away, or if you don't have your own practice by this age or by this number of years out, you're like not doing as well, or things like that. Like if you put all these pressures upon yourself, it's just gonna drag you down. And dentistry is like so hard on so many levels, or just medicine in general, trying to constantly feel like, oh my god, I had this calling but it's not going like this perfect path, then it can really bring you down and be very discouraging. So trying to be open to, okay, you know what is the right fit for the path. Maybe it's not going to be opening right away because I want to take these courses first, or maybe I have this mentor that I really want to learn from first, and then kind of gauge and see where I'm at. Maybe like you thought you're going to be restorative, and then it turns out you really love a specialty. But being open to those things, and being open to maybe your journey is going to change. Maybe the location you thought you're going to be in might be different. Like, oh, you have this amazing job opportunity in this other state, you weren't expecting to be there, but like it's, you know, it's a new and exciting opportunity. Just being open to those things is being really important. But on the like when we are being open, I really advocate for trying to really decide what are your strengths and weaknesses, what really makes you happy, brings you joy, because you have to take those like little joys of what we do in practice to make it something that you can be passionate about all the time, right? If you just drudge on all the time and you're just unhappy all the time, you may have to consider like maybe I should pivot, whether it's that job is just, it's bringing you down into a bad mental space. Maybe those types of procedures are not going to make you as happy, right? Like Frank Spear, I posted about this before. He did a fantastic lecture before. If you can listen to it, about like, it's about, he talks about his career and how he decided he was going to put his path. And the biggest thing as he talked about is like, do the things that make you happy, do the procedures that make you happy, treat the patients that make you happy, work with staff that make you happy. So what that looks like to each person is going to be a little different, whether it's going to be their own staff that they choose, that they partner with, that kind of thing. It's all going to be different for everyone else. So really honing in on, okay, what is making me happy or not happy, whether it's certain types of procedures, you may want to cut them out if they're really just making you so unhappy. And then figuring out, okay, what kind of practices? Are you an early morning kind of practice person? You want to see patients at 7 a.m., you want to finish at 4 p.m., done. Like, or are you a late morning, oh my gosh, like, it's really rough to get out of bed. If you're like, I am not a morning person, I cannot see an 8 a.m. patient. Like,
Me neither.
even right now, like today I had 6 a.m. like peds patients, as because it is a special needs like pediatric sedation patient. I will do it because of like the parents are asking me and pediatrics is asking me, but I am not doing 6 a.m. on the regular. Like,
Right.
this is a once a month thing.
I
Things
love
like that.
that.
Really deciding what makes you happy, what brings you joy, and what kind of people will bring you joy. So the kind of staff, even honing in, well, you like your assistants to be a certain way. To some people like really talkative assistants because they want to be the ones to be a little bit more introverted and have the assistants do all the intros. Some people love assistants who don't say anything. A little intense for me, but that's just their vibe. They like to be
Right.
the one to speak, to talk everything, and the assistant just is like a machine, like well oiled, passing instruments, doing stuff, but it's like silence. It's like a beautiful symphony, but just in silence, right? You'll see surgeons or who are like that, or chefs who are like that.
Yeah.
Same thing with the types of staff and the types of scheduling. A lot of people talk about like how you schedule. You know, people say, oh, what's most productive, block scheduling, blah, blah, blah. Besides that, also decide like how you want to schedule your life. Do you want to start off with certain procedures? Do you want to end with certain procedures? Do you, is waking up first thing in the morning to do a like gnarly calcified case with a like awful post to remove and stuff like that, might not be everybody's cup of tea. Some people that like drives them. Some people want to start off with like huge extractions, implants, all that stuff, and some people want like, you know, they dream to start with like a full mouth rehab type of case, you know, or some people like to end with a full mouth rehab. You really want to think about those things that kind of like make you happy and like can keep you going and like drive you to still want to do a lot, because that will help you be happier, that helps you do better treatment for your patients, and then that will help you like continue to have that passion in what we do.
From everything that you're saying, it sounds like as a student, I'm like, you have choices now. I'm
Yeah.
like, oh my gosh, I never like thought of so many choices.
Mm-hmm.
And like that's the thing that's exciting but also daunting to me.
Mm-hmm.
And like something like a choice that I have to to actively think about and make right now is something you touched upon, which is like finding the right mentor. I feel like finding mentorship and finding the right associateship, it feels a lot like dating, because there's like people on paper where you're like, wow, and then you meet them and you're like, that spark isn't really there. And then you get blown away by the people that on paper you weren't expecting, right? So for you personally, what do you look for in a mentor?
Okay, great question. So I would like to say, first off, with a mentor, like, enjoy the ones who can help you a lot and who give great guidance. It doesn't necessarily mean it's forever. You know, maybe it's for a season, maybe it's for a reason, whatever that is.
Yeah.
But you know, like, they'll be the right mentor in that situation. So don't feel like you're absolutely locked on, like that's it, because you know, you never know what happens with the different mentorships and where you grow as a person. So you know, again, with that whole keeping an open mind thing. So but what I look for in a mentor in like that kind of space is like, okay, well, what is what am I looking to improve on for that thing, right? So I had restorative mentors, and then I had endo mentors. That's what I'm saying, like, you know, things can change and stuff. um and then, so if you're like looking to improve, you want to try to focus on who is excellent in that kind of thing that you're looking to improve on, whether it's like practice management or like restorative or specific procedures. You know, then contact them and be open to it, and see like, okay, if they're open to, even if it's just talking, not to like necessarily start with like, oh my god, be my mentor, but more like, hey, I'd like to ask you a lot of questions. What I really like about like the Instagram community is you can kind of see who really does kind of work in your style, and then a lot of people are super nice and that you'll reach out and they give you a lot of great advice. And then but also like looking for somebody who, you know, is kind of more in line with your style and personality too. So like if you knowing really kind of knowing yourself and what you're looking for and how you want to practice as a practitioner is going to be really important when choosing.
These are all things that like I wish that school could have taught us, but like school can only teach us like so much, really. They're like busy teaching us how to like not hurt someone. And like that's kind of it.
Exactly. And it's really hard to teach some of these like you know, soft skills or whatever,
Yeah.
like being a leader or being a business owner and things like that. Those are really hard to teach. I mean, they don't even teach these things in MBAs, let alone they're not teaching when they teach like at an MBA, even at the highest level MBAs, you know, Wharton, Harvard, stuff like that. They're not literally teaching, this is how you become a CEO. Like,
Right.
it's more the kind of general skills associated with that. And certain people have like the, you know, opportunities or the skill set or whatever to do that thing. So it's same thing. I think dentistry often does a pretty good job of like the kind of people who want to go into it to have a really nice balance of like personality, hand skills, and scientific kind of thinking and background. And then so that's why it often kind of already like feeds into for people who have that personality to begin with.
Right, like a certain type of person.
Yeah.
Also, like now that I'm thinking about it, if my school ever had like a leadership class, I would probably be like snoozing through it or like not like shopping while like I wouldn't be like
Exactly.
seriously being like how to be a leader, you know?
Yeah, or even like how to talk to patients, right? Like, I mean,
Yeah.
we've all look. Every single dental school has the practice on each other, you know,
Yes.
practice on fake
Stab
actors,
lab.
classes, all that stuff. You can learn it to an extent, but number one, everybody has their own style of talking to patients and presenting treatment plans or being all that stuff. You can have little tips and tricks and stuff like that. And I definitely, on your note about asking about a mentor, I definitely love, you know, asking more experienced clinicians and more experienced doctors, like how would they have approached this particular problem? How would they have approached this kind of patient? How would they have said something? And they have given me so many awesome pearls that I use to this day. But those are not pearls that you can teach every single like line in dental school, because it's not a script. People are different. And how do you it's very hard to teach reading people. It's very hard to teach personalities. It's very hard to teach like understanding motivations, understanding what drives a patient, understanding like what is making someone happy or sad or not. So You can teach that to a certain extent, but I mean, that's a really hard skill. Like reading people, that's
Right.
not exactly the easiest. You can only learn so much, but part of that is also just kind of developing your own style. So, on that note, and you were saying like, how did I think about like what I liked to do or how I liked to treat patients and stuff like that. And like for endo, it's all about initial impressions with patients. It's really thinking
Mm.
about, okay, patients can be really scared about when they first come. What can I do to help ease their fears, but with my kind of personality? Don't feel like, well, just because um, this like older male dentist might say like this, would it necessarily work for you? Would it work for your style? Would it work for your personality? So yeah, be happy
Mm.
with like kind of figuring yourself out and how you like to approach things, how you like to talk to people. That's going to be really important too.
You know, as an endodontist, you've been put in a situation where a lot of times your patients are coming to you in like the worst pain of their life. Like they're not having a grand old time. It's not popping in to like just say hi, really. What have you learned about like kind of managing patients that are at that high level of pain, super unhappy currently?
Mm-hmm. So I think that's like a common misconception about endo. It's that people don't realize that endo really requires great first impression skills. So if
Mm.
you look at all the different specialties and you want to think about like how do they treat patients, how do they like what kind of patient care is it? Restorative is long-term care.
Mm.
Orthodontics is long-term care. Endo and OS, you're meeting me one day. I maybe 2 days. I always tell a patient if you have to see me a whole bunch of times, it's probably not a good idea. Whereas you
Yeah.
want to be seeing that restorative dentist a lot of times. Restorative dentists get the benefit of long term, they're developing long term relationships. So they're learning about patients from their babies to when their
Mm.
babies like grow up and graduate school. They get to know people from when they're kids to when they get married. They get to see that beautiful like relationship blossom. Endo is that you have to ease a patient's fear and like have them trust you and feel comfortable in your care from the first 10 minutes. So it's much more of a like short term but high reward in many ways because it's instantly helping a patient feel better, instantly treating a problem. So there's different kinds. You have to like whenever people kind of look at the different specialties and things like that, we're all treating patients in a slightly different way.
Mm.
So with endo, it can be really tough because people are in often so much pain. They haven't slept, they haven't eaten, everything's uncomfortable, and worst of all, they're coming in with that like connotation or that stereotype that oh my god, root canals are horrible, root canals are
Right.
scary, root canals are like gonna be miserable. So definitely, I like to try to reassure them. My personal style of talking to patients is definitely a lot of like high value education, telling them, exactly what's going to happen. I think really my focus, especially as a woman, so I look at it how I would like to know when I'm being treated.
Mm.
So as a woman, like historically, women often feel like they don't get enough information with a doctor, that they are just, the old school doctors, the way was just, you need a root canal, that's it. You don't ask why, you're not asking what your options are, you're not like, that was just an old school mentality of medicine, right? Just
Mm.
the doctor says, so I'm going to do it. And then, unfortunately, because of that old school mentality, that also really bled into like a lot of women feeling like that in their problems and their kind of healthcare. So I never like for a patient to ever feel like they were forced to do something or that they didn't have the information or if only I had known or I wish I
Mm.
had known all the possible side effects. So because that's personally how I would like to be treated as a patient. So I definitely like to go over, exactly why that they are like there with me, what I see, what I find, showing them what the testing showed, and like showing, okay, so see how that's different, or see what this looks like on an x-ray, explain that to them so that they feel comfortable, that they feel educated, and that also letting them know exactly what to expect after. So nobody likes surprises. So that's personally my style. I
Mm.
also like to make it a little bit more like lighthearted or kind of a little bit with a little bit of levity compared to just because like it doesn't have to be so dreary and depressing and stuff like that because endo is so scary as it is. So it's like,
Right.
I'm a petite woman and I'm not a scary kind of person, so I'm gonna make it kind of like a little bit more enjoyable and fun and like, hey, this is how it is. Try to crack a joke here and there, that kind of thing. But it's really about finding your own personal style.
Mm.
So when a patient is like really in a lot of fear, I try to reassure them and then continuing with that reassurance throughout the procedure. So I actually do talk a little bit more during my procedures and kind of let them know how things are going or let them know because that's something I think that people don't really realize that makes dentistry like harder as a type of like healthcare is that when we're doing our procedures, unlike surgery, like medicine surgery, patients are asleep, they're out of it, they don't.
Yeah.
Our patients are awake. We're in their face. They are staring at us while we're working. And no matter what procedure you're doing, no matter how bad the procedure is going, you still have to maintain like constant pleasantness, professionalism. You can't like, surgery they talk about in the OR, surgeons are always swearing and stuff like that. You can't do that with a patient. You can't
Right.
be like angry, throwing stuff down, whatever, with a in front of a patient. You have to maintain like this level of general pleasantness and professionalism. So a lot of times that can make what we do really, really hard.
Yeah. Oh my gosh. That's exactly what I always say to my friends is I'm like, imagine doing surgery, but it's like this close and like the patient thinks they know what's going on, but like they don't actually know what's going on. But then you see our like eyes darting back and forth.
Hmm.
It's like it breeds this ground for confusion. Quick question.
Sure.
What are you wearing at work? Are you like super cute dressed up or do you wear scrubs to work? I'm
Oh
just
no,
like
no,
trying
no,
to envision it.
scrubs for sure.
Really? You got scrubs?
I always wear scrubs. Well, ever since like COVID, I definitely started wearing scrubs all the time, and
Uh-huh.
especially because nowadays there's so many scrub companies, as we know. We don't even have to list all of them, but there's so many of them
Yeah,
that
yeah.
are like really cute. I do. Okay, so I don't wear dress clothes anymore because if I get hypochlorite on them, it's done. So I don't want
Oh,
to do that.
true.
And you definitely want to wear comfy shoes because if you wear dress clothes, you can't really wear like sneakers with them. It's just not as
True.
comfortable. So like when you're walking around, you're on your feet, you're going from room to room, you want to be comfortable to a certain extent. But how to like set yourself apart with like a little bit of style and stuff like
Yeah.
that. I usually like focus on the jewelry. So like, the eye makeup doesn't have to be really involved. I don't really always wear makeup for me because, we're masked up thanks to COVID and with like caps, but I do try to have like a little jewelry on. So like cute earrings or like a cute necklace, and if you like to have like nice just nicely done eye makeup, that can help because, then through the mask. I personally don't wear scrubs with a lot of colors just because well, first off, it's New York and everything's in black, but also, but also because I do, I want to fit in with the rest of the staff and the docs who usually wear black, but also you want to have this like feeling of confidence, and I don't necessarily ever want to be like have my patients like perceive me in a different way because it's like bright pink. So, but
Mm.
that is not to detract from anybody who likes to wear pink scrubs. I think it's awesome, but personally, I just wear like black or navy blue and like cute gold jewelry usually.
That
Hmm.
makes sense. It's kind of like feeding off of your audience, because
Yeah.
like if your audience would prefer like that certain color, then that makes sense. Or
Hmm.
if you know that they would interpret things a certain way.
Hmm.
Where's your favorite place to get cute gold earrings? Because I'm trying to find a place that's like not gonna break the bank, but also
Hmm.
it's stuff that's not gonna like tarnish. Like I'm ready to start like investing and stop going to Forever 21.
Okay, solid gold jewelry, 100%. First off, my ears are a little sensitive, so no nickel for
Oh.
me. But I hate vermeil, okay? All the things that, oh my god, vermeil is really great. It's a layer of gold, blah, 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 blah. No, forget it. It's
Why?
a
What's wrong
lie.
with it?
Gold vermeil tarnishes always. I don't care what.
Really?
I've bought them from different brands, like including the little medical labeled ones, all that. Every single one is tarnished. And even the companies like that sell it,
Uh huh.
they'll tell you it will tarnish over time. You have to like polish it and all that stuff. So even like just say like the classic Majori, if you
Yeah.
buy vermeil, they tell you straight up in the store like, hey, these are going to like change color a little bit over time. So just keep that in mind. So solid gold jewelry, or make sure like it's very well gold plated. So
Mm.
from for a price range, gold plated that's like won't tarnish and has really really good quality. Etsy has a lot of them,
Mhm.
and
Okay.
then in the affordable like solid gold jewelry route, then you have like Majori, and that. range, or 8, things like that. So majority is actually fairly solid. Yeah.
If it's solid gold, does that mean that I can like wear it in the shower?
Dude, I'm a lazy girl.
Yeah, me too. That's
like, I'm a lazy girl. Gold, solid gold, shower, sleep with it, all that stuff. You're good.
Okay, yeah, I need something like that because like the reason why I always forget to put on jewelry is if I have to take it off before the shower, I'll never put it back on.
Exactly.
Even with my engagement ring, because like I always wash my hands. I have to like be better about like. Do you keep your engagement ring on when you wash your hands?
Always. In fact,
Always.
as a fun fact, my jeweler said that it's actually good to just keep it on because the soap keeps it clean anyway. And how to clean diamond jewelry, just fun fact for everybody. He said it's literally just soap and a toothbrush. You don't need fancy jewelry cleaners. Don't use ultrasonics. Ultrasonics can actually shake the stones out sometimes. Toothbrush. This is coming from a jeweler who like works with all different types of nice jewels and stuff like that. For diamonds, toothbrush, soap.
Oh my gosh. Okay, that like makes me feel so much better because like me, I feel like I'm not used to like nice jewelry, so I'm always like, oh, I have to take it off because like I don't want to like get it dirty. So I feel like you're someone that's like super inspirational. It's so easy to like listen to all the advice you're giving. Yeah, no, seriously, and like look at you and all of your success, and it's just like, wow, she's like, she has it all figured out. Take us back to like a time or experience or a challenge that you've actually gone through behind the scenes with your career that like maybe we wouldn't like know about.
Definitely feeling confident in like the procedures and like your ability as a doctor is going to be the first challenge. Like, you know, imposter syndrome is real for especially for a lot of women. I think in many ways it's trying to get over that feeling or that that assumption of people underestimating you and sometimes you underestimating yourself. So having that confidence of like, okay, you have worked really hard to get where you're at, like knowing where knowing what you've learned and like the struggles you've gotten through along the way definitely can you want to focus on that and have that confidence as a practitioner and have that confidence of like, yeah, you do know like what you are recommending and what you're talking about, because it's very easy to like, wait, you know, I had some pushback or it didn't achieve that. Do I know enough? Am I good enough? All that stuff. Those are really hard like areas to overcome at first, and then also being open to the fact that the path that I thought I was going to take is not always going to be there, but it's you know, I think you touched upon it a little bit in your Lucky Girl video podcast episode recently.
I can't believe you listened to it.
Oh, I love I love a lot of the podcasts. I think you have a lot of great little nuggets of wisdom and also just like a lot of good food for thought that I think a lot of people, and women especially, but a lot of people can learn from. So it's like maybe your path isn't going exactly the way you thought it is, but at least put yourself in the positions and the opportunities to either try to get the path that you think you're going to, or at least be open to the path, like a different path that maybe that opportunity is showing you, hey, this is going to be pretty good. So that can be like a job opportunity. Yeah, it might be in a different location, but you know, you're going to take that because it's going to put you in like a better position to do X, Y, and Z. So for me, part of it was like deciding on going into endo, where I was going to go into endo, and then where I was going to practice as an endodontist. So I like really thought originally so I practiced in Philadelphia for a few years as a general dentist, and I totally thought I was gonna be like going into one of the endo programs of Philly, because Philly is like, you know, historically this cradle of endodontics. It's like
really, I didn't know that.
Yeah, some of the earliest endo programs, like the history of it, like some of the earliest. You know, I was a big endo nerd even as a GP, so I was like, some of the earliest papers, from the 1960s. Those are from these like Philadelphia and endodontists, and like I want to be part of that history, right? Like that, like the name and the prowess and all that stuff of like Philadelphia programs. And you know, it ended up just like not working out. But then also, okay, when I applied to as many programs as I could, because I was like, I want to make sure I get into endo. I love endo. At that point, I knew I loved endo. That was it. That was my passion. and for me, I was very open to wherever I went into residency. I was just like, I don't care where the location is. I can deal with it for 2 or 3 years. I just want to get the best education possible. So, part like a fairly new program at the time, University of Tennessee. I was like, well, you know what? I'm just gonna throw my application in there. Tennessee wasn't really on my radar. It was a fairly new program, like only a few years old at the time. Didn't know much about it. I was like, I need to make sure though I have as many opportunities as possible. You never know where you're gonna get in. My heart was set on Philly, but let's see where else. And then when I was doing my application for Tennessee, I was like, they're asking for an additional essay. Do I really want to apply here? Okay, wait. Oh, never mind. I need to make sure I give myself that opportunity. All right, let me do it. And then, so I applied to Tennessee, and then when I did that interview, in comparison to all my other interviews, including my Philadelphia ones, I was like, wow, Tennessee, they really seemed like it was a great program, but most importantly, that mentorship thing, the director, when you're choosing any kind of residency program, whether it's GPR or specialty, the director and the chairman totally affect the entire atmosphere and the attitude of the program. They are going to be directly your mentor.
That makes sense.
Though the director and chairman of Tennessee at the time were like super kind. They like knew my application inside and out. They like were asking about, like, so that means they cared about who I was. There were some places like that barely looked at my application, but like there were some when I did the interview, you could tell. But in this case, when I did the interview, it was like truly that they knew me personally. They were trying to get to know me personally, and that they really cared about like what I would like and not like about this program, and that they cared, and so they seemed like they would be really great mentors. And it turns out that was the right fit. It was like the perfect fit. So I took the acceptance, and it like I ended up loving the education that I had at my residency program, because the chairman, who's at the time, he's no longer there, but at the time that chairman was like the best mentor. He was supportive to me, not only as an endo resident and like understanding what my interests were and my aspirations, and also trying to teach us as much as possible about endo, but also supportive of me as like a woman. So he really knew, because I was the only female in the program. And
really, wow.
yeah, I was the only.
Wait, how many?
Out of 3 in each class. So I was the only female out of 6 for all of my time there, basically. Like,
that's insane.
The 2 years before me and the 2 years after me, there were no women. And so at first, like, I was really worried, because my director had very high standards for us. He had very, very high standards for what he expected of us, how he wanted us to do endodontic treatment, to know the education, to know the literature and everything like that. But then sometimes I was worried, like, oh my gosh, I'm the only female. Like, I need to be at a higher level. Like, not literally, but sometimes you want to prove yourself, right? You don't want to be underestimated. I was the youngest resident also as well. So that was like really daunting at first. But then he really understood, like, he never was extra hard or treated me differently or was like ever any rude. He was very protective for all of us as residents too at the program. So it was that kind of like mentorship that really, I think, made a difference to how I am as a specialist too. And he was also very, very supportive of what our future aspirations were. Whether it was for me, I was interested in lecturing and speaking a little bit, and he really helped to like develop that for all of us just in case. But also about like a little bit about business management and about like procedures and about endodontic treatment, all that stuff. So he was like really, really helpful and a great mentor for all those things. Dr. Lloyd. So shout out to Dr. Lloyd.
Oh, that's so cute.
Yeah, so the moral of the story of all this is like putting yourself into as many opportunities as possible, just in case the path might be different from what you thought it was, but that way that you are keeping yourself open to all the possibilities, and maybe a path that you didn't realize is actually the right one that's meant for you.
I really love that advice, because I feel like sometimes when people hear the advice of like, put yourself out there, things might surprise you. It's easy to think like, oh, this person lucked into it. But really, what putting yourself out there is it's scary, it's daunting, but it's like believing in yourself, and it's making that conscious decision to like bet on yourself, even though you're not sure if it's a viable option. Like think of like all the opportunities where you're like, for example, you were like, do I really want to do this extra essay for this school? Imagine if you didn't do the extra essay, right?
Exactly.
What advice do you have for anyone listening out there, any woman out there that's like, say she's like the only woman in the office that's like dealing with that kind of situation? What words of wisdom do you have for them?
Oh, you mean in a like private practice setting, or did you mean in a residency like program?
Any setting where a woman's listening to this right now and she feels like she's really in a male dominated space.
I mean, I feel like we're all often feeling like that in healthcare and at work and at
It's life.
in residency and stuff like that. But like, it's tough. I'm not gonna lie, it is tough at first. It's tough because of sometimes there might be weird kind of attitudes or prejudice against us, but sometimes it's our own the stuff that we kind of put on ourselves, the extra pressures, the extra like constant thinking about whether or not you're doing it the right way, or you're doing it the best way, or you're performing at a higher level. And a lot of times, the patients don't actually mind as much as we think they do. In fact, a lot of times they feel more comfortable with female practitioners. So actually trying to find the joy and the happiness in those types of things. And also like, taking those like little wins, the patients who are like, oh my gosh, you were so kind, you were so caring about with your treatment. I really felt like comfortable with you as a doctor. So taking those little wins, and then those male dominated kind of fields or male dominated situations, a lot of times the people there are actually more supportive than we think they are, but it's trying to just connect with people just on a personal level that can help you get there. So we all have kind of initial thoughts about people or how they think how they're going to perceive us, but just getting to know people as people, then a lot of times that will really help making those connections so that people just connect to people.
You touched on something, talking so much about confidence and things like that. You have a skill that so many people out there like want, and that is you're a really good public speaker. I know it's like part of your job as like a KOL, and you're like a lecturer and like all of that. And we touched upon this briefly before we started recording, because you were like, well, like, I don't know, like, in terms of, like, advice, what I would really give, because I think, like, some people have the skill, some people, like, need to develop it. But I think everyone, when they're watching a presentation, they can tell, like, oh, that's a good presentation. So what are qualities that you think make a good presentation or speech?
Okay. So that's a good question. I think especially with in relation to like social media, we're looking at now social media is about a lot of like short form videos, short form content, a lot of like visual, high aesthetically pleasing visual content. I think a lot of good lectures now for everything, right? Whether that's like a TED Talk or dentistry or medicine, a lot of really good lecturers and a lot of good presentations now come with really good visuals. So learning how to make those really good visuals, whether that's like small videos or small like graphics or things like that. Canva can be your friend, Keynote is your friend, or now PowerPoint is great at it too. So learning the ins and outs of it to make it visually dynamic is going to be really important, and that goes for everything like in the way we present. Another thing is for like public speaking and lecturing. So I personally didn't do like a specific lecture course or speaking course. I do know really fantastic lecturers who did. So a couple of good friends of mine, they did things like Toastmasters and things like that, where it forces you to do a lot of public speaking and a lot of that type of public speaking. That's going to be really important. I think that can help a lot of people. I didn't do that, but I personally, when I was in high school, and I did a lot of speech and debate. So that is where I got some of my kind of background in public speaking. I did like speech and debate, mock trial, and like other kind of competition level like speaking. And then lastly, I think when we're doing that speaking, and whether that is for lectures or presentations, or even just how we present it to a patient. I think it's really important to have like a clear order to things, kind of like not only a clear outline, but also like a clear story. So where it's going. So whether that, if that means that, like, even when we're speaking to a patient, right, there should be an outline, like, okay, why are they what brought them here? So what are their symptoms? What are you finding? What is the diagnosis? What are the recommendations? Can they expect after the treatment of recommendations? So that type of outline. Have your little, not literal script, but have your little kind of like process of how you speak. And that also goes for lectures. Like, I like to have very fairly organized lectures with an outline, a main idea, kind of like 5-paragraph essay from back when we were in school.
Yeah.
Right? Idea, details, and then introduction, conclusion, all that type of stuff. So that type of layout for lectures and for speaking is great for both just everyday type of speaking, and then also for more professional presentations.
It sounds like a lot of what goes into that then is kind of like when we approach making a presentation, people think like, okay, what do you want to say? But really, you should be approaching it from a perspective of what do you want them to hear? Like, how do you want them to think?
Or like, what do you want them to come away with? What are the main ideas of the presentation? Like, whenever we go to a like healthcare lecture, it always has like, okay, these are going to be the talking points, or these are the learning points of that lecture, right? Yeah. So you want to focus on those learning points. Okay, it should be like 3 to 5 main ideas, and for each of those main ideas, it has details. So it has the literature that backs them up and example cases, that kind of thing.
Got it. Well, it has now been, this hour like totally flew by. I don't know like how it did. Literally, I just like looked up at the clock for the first time and I'm like, oh my gosh. Yeah. This was like such a fun conversation. I just want to say thank you so much. I feel like all of the advice that you gave was super helpful, super in depth, and it was just really great having like such a vulnerable chat with you. If you could just leave everyone before we go with like all of your information, where they can find you, and like any sort of like email or anything, any way that they can contact you.
All right. So thank you so much to everyone who's made it to this point of the video and has listened to Connie and I and actually not just Connie, future soon to be Dr. Wang.
Thank you.
Talk a little bit. If you want to learn a little bit more about endodontics, about endodontic education, definitely feel free to follow me at my Instagram. I'm a big fan of puns and dental jokes. You'll see on my Instagram. My Instagram handle is Her Holiness the Pulp.
I love it.
Pulp. With underscores in between. And on my Instagram, you can also see a lot of endodontic education, specifically like tips, tricks. I answer a lot of endodontic questions on there. I also talk about my endodontic lectures. So I lecture specifically, if you want to look up my lectures, I lecture specifically with Brassler and Henry Schein, and also soon with Plan Mecca for CBCT coverage. So you could definitely see the specific links on my Instagram, as well as if you just go to Henry Schein and look me up, Dr. Stephanie Tran at Henry Schein. You can look up my lectures. A lot of them are on demand. And then if you have any specific questions, you can contact me at my email. It's sattrands@gmail.com. So thank you so much. I look forward to if you have any questions, if you want guidance, if you want me to, take a look at a case or something like that, feel free to contact me.
Oh my gosh, your inbox is gonna get flooded with people because I feel like endo is like.
I'm pretty used to it by now, so I get a lot of questions and stuff like that. But hey, that's how I learned when I was starting out as an endodontist too. That's how I learned from both my mentors and also great mentors on Instagram and stuff. So there's definitely a lot of help out there, and the best thing we can do is help each other too.
That's so true. Thank you so much for your time, Dr. Steph, and thank you so much for everyone for listening. That's all I have this week, and I will see you guys next week.
Thank you so much, everybody. Bye. Have a good night.